Good morning, everyone. I wanted to share with you a presentation that I did in July 2025 at the World Psychotherapy Congress, dedicated to polarities of life, and held in Vienna at my alma mater at Sigmund Freud University. It was a privilege to be invited here and to present among many stars of psychotherapy and neuropsychology and neurobiology. It was a fantastic event, span across 4 days, 4 full days, and many colleagues have met. And so I've decided to share my presentation with everyone because I think it's important, and I want to share it beyond the psychotherapeutic community because it does help a lot of the people that I work with. So without further ado, I want to start with a question. What if the words our client uses, not just what they say, but how they say it, could tell us more than any diagnostic manual ever could? What if language is not just a tool for therapy, but the diagnosis itself? A few years ago, I was working with a teenage boy. Let's call him Mark. He came in with his mother. She spoke, he didn't. For 3 sessions, he said maybe 30 words. But those 30 words told me more than his file ever could. He spoke in fragments. No subject, no agency, just effects. Got in trouble. It was bad, not going back. No I, no verbs of intention, no inner world. That absence wasn't a silence, it was a signature, a diagnostic signature, etched in language. I have always been interested in personality development, and through 30 years of research, one way or another, I came to an understanding that language is a common denominator for personality development. It's not just how we express ourselves. It's how our personality, our emotional history, and our relational blueprint make themselves known, moment by moment, word by word. Who has children? Do you remember that young children have this toy? It's like a small pyramid. You have stick and then you put rings on it. So now think of the stick as our core that we're born with, our predispositions. And then all the rings are how this core is going to be expressed with all the trauma, experience, love, everything that we're exposed to. And first, I want to start with the first ring. First ring is, of course, attachment theory and mentalization. What do securely attached children do? They tell stories. Their narratives have characters, motives, feelings. They use mental state terms. She thought I was angry. Their language mirrors their inner world because it was mirrored to them. Peter Fonagy, calls this mentalization. It's the bridge between emotion and reflection. And that bridge is made of language. Moreover, attachment theory of John Bowlby and then works of Peter Fonagy speak to this ring in our pyramid, the foundation to our interaction with one another and mentalization of these. Second ring, or psycholinguistics. Vygotsky, Leontief, Chomsky. Language doesn't just reflect thought, it shapes it. Leontief spoke of speech as activity, a developmental mirror of our agency. If someone can't use verbs of feelings, if their syntax breaks when they discuss a parent or a partner, that's not random. That's where the trauma lives and how the story collapses. The way we choose the words, the syntax, the metaphor, all of these reveal personality traits. Our narrative brings us back to our attachment style and further allows us to assess the development and emotional regulations. The third ring is Affective Neuroscience by Jaak Panksepp. The seeking system, the care system, fear, rage, grief, each one of these primary emotions colors the way we speak. People are so dumb, we say with rage. I just want to understand, we say, seeking and caring. Language is the mouthpiece of this circuit. And if we know what to listen for, we're not just hearing symptoms, we're mapping emotional circuits. Panksepp works demonstrate core emotional systems. My methodology includes implicit language analysis and developmental narrative assessment. We'll link language use to affect regulation, mentalization, and defense mechanism. Fourth ring on our pyramid is multiple intelligence. Started by Howard Gardner, I integrated it through my methodology that I've developed with colleagues through many years. It's called Psychonomics. It captures how intrapersonal and interpersonal intelligences show up in language structure, rhythm, metaphor, and coherence. It is a human-centered way to read not just behavior, but being. With Psychonomics, you are able to assess personality through language and see the parts that are coming forth and take center stage during sessions. Moreover, it becomes an instrument that your patients or clients could walk away with for self-discovery and implementation. And this transpires through very basic conversation. For example, if you ask for directions, one person will tell you everything in great details. Another will tell you everything in numbers, 300 meters there, 200 there. A third will tell you you'll go and there's going to be a beautiful tree and that's where you turn. It is the same message wrapped into a different linguistic packaging. And we would think that it's just words, but it tells you something, a lot actually, about the parts that are engaged that this client has and expresses. And the model of Psychonomics is multidimensional. It lives in 4 dimensions: time, information, energy, and space. And like everything in the world, we have it directed outward, the extroversy, and inward, the introversy. So the system, the model, is comprised of 8 intellects. An average person is born with 4 to 6 of them. Now, you think more is better, but it's not, because the more you have, the more internal conflicts you have, and then the more you have to fulfill. Each intellect is comprised of 4 unique categories: our life values, personality traits, behavioral patterns, and linguistic abilities. Each one shaped by experience, context, trauma, love that was accumulated through years, by those circles that shape it. Psychonomics becomes the stick of our pyramid. Here's the model. At the center, there's language. Surrounding it, emotion, attachment, personality, temperament, defense, and memory. Language is their meeting point, their expression point. Language, both spoken and written, is like a fingerprint unique to each individual. Again, the polydynamic approach integrates psycholinguistics, affective neuroscience, and attachment theory. We draw on Vygotsky's sociocultural theory and Leontief's activity theory to understand how speech reflects developmental stages. Speech rhythm, complexity, and metaphor reveal cognitive emotional patterns and show parts that are present. Let's go back to Mark. After 6 sessions of indirect conversations, storytelling, metaphor work, his sentences began to shift. I wanted to go, but I thought they'd laugh. First time he used I. First time he connected thought and feeling. That wasn't just progress. It was diagnosis through evolution. This approach works for children, age-appropriate expectation of the language development, teenagers, adults, and across family dynamic. I had the opportunity to work with all types of clients that I mentioned, and moreover, to work across different cultures. Imagine this approach scaled up. intake sessions coded for attachment and personality speech, supervision models for emotional language detection, diagnostic listening as training standards. We move from checkbox to conversation, from symptom to system, from pathology to pattern. I argue for shift in practice toward diagnostic listening and language-informed case formulation. It's about tuning into the speech as a live reflection of the therapeutic process and inner world. So what are your clients really telling you when you speak? And what are they showing you when they don't? Language is not a symptom report. It's a biography of self in motion. And if we're quiet enough, if we listen well enough, we'll hear the whole story before they even know how to tell it. I invite you to connect for research, to further expand the instruments. I have a program that's designed for clients and patients, for individuals who are interested in learning about themselves and exploring themselves. Stay in touch. Thank you.